Hi, I'm James Bradley. We're going to be talking about facial feminization surgery and specifically about perioperative care. This is a very important step in your journey as a trans woman. Sabrina is going to be talking to you about preoperative instructions, about recovery, about postoperative care. So please listen. I think you'll find this very interesting and informative.
Thanks, Dr. B. I would like to start off by going over the 3 goals of this short video. First is describe the process leading up to FFS. Second is to convey perioperative information. And third is to help you feel more comfortable. At your initial consultation, you will have a formal evaluation and review the facial features that you want to have modified. If you're using insurance, we will submit for approval. If you are unsure about features you want to modify, we will hold off on submission and can meet again to discuss. It is usually better to be sure than to add procedures later because it may delay your approval. During your initial consultation, you will receive an informative folder. You should read through this folder thoroughly. It includes pre- and post-op instructions for surgery, facial feminization surgery brochure, information about Dr. Bradley and our team, and our business cards with their contact information. Please keep this folder in a safe place for reference. After the consultation, you will obtain a CT scan that is used for virtual planning. From the 3D images, operative guides and custom plates are created. You will need to provide us with 2 letters for insurance approval. One is from your hormone provider, and the second is from a therapist or psychiatrist. Once we get approval from your insurance company, we will discuss operative dates with you and set up a preoperative visit. For the preoperative visit, please make sure your natural hairline is accessible to Dr. Bradley and be prepared to remove all makeup and accessories so we can create a surgical plan for you. At this meeting, we will go over any questions that you may have and discuss the surgical plan. In preparation for surgery, please avoid smoking cigarettes, marijuana, or vaping for at least 3 weeks before surgery and 4 weeks after surgery. This is meant to optimize healing and avoid complications. Also, rest, eat healthy, stay well. If you catch a cold, your surgery might have to be postponed. Pre-admission testing must be completed within 30 days of surgery. You will need to make an appointment with your primary care provider for pre-surgical evaluation, blood work, and to have forms filled out. Please have your primary care doctor fax these forms to our office at least 7 days before surgery. If you have had the COVID vaccine, you must submit a copy of your vaccine card to our surgical coordinator. If you have not received the vaccine, you will need a PCR COVID-19 test 48 to 72 hours before surgery. This will have to be completed at a Northwell facility. If COVID and pre-admission testing are not done, the case will have to be postponed until our next available date. The hospital will call you the night before surgery to let you know what time to arrive to the hospital and the time of your surgery. Remember, do not eat anything after 12 a.m. the night before surgery. For the day of surgery, we will meet you in the morning to go over the operative plan one final time. This is your time to express any final concerns that you may have. We have an excellent team that is very familiar with these FFS cases since we are one of the highest volume FFS centers in the region, US, and the world. The surgery will be about 7 hours. You will spend 2 nights at the hospital. For recovery, please keep in mind that the swelling will increase the first 2 days before slowly coming down. Your appearance during this period is no indication of your final result. All dressings in the drain will be removed before you leave the hospital. A jaw bra will be placed before discharge and should be worn 24 hours a day, except when showering. At home, it is important to rest and keep your head elevated in bed with at least 2 pillows. You will be on a liquid diet at the hospital and then a soft diet at home for 2 weeks. You may buy soft foods before surgery in preparation for your soft diet. After each meal, you should rinse your mouth with Paradex or half-strength hydrogen peroxide. Just remember that it is normal to feel tired and run down during this period due to the stress of your surgery. You may shower from the neck down, but please avoid submerging your head underwater. It is medically safe after 2 weeks to return to work and set up meetings. However, it will take up to 6 weeks to feel more normal. Then, it is your time to celebrate your new look and live your authentic life. I hope you found this perioperative information and our guidelines helpful while embarking on your journey. Remember, we are here to help you.
Thank you, Sabrina. We hope you found that useful. We look forward to working with you.